Hi all, my name is Geeta Sanu, Nursing Tutor Plus Academy Tiruvalla. In today's class, I will tell you how to assess the level of consciousness of a patient using GLASGOW COMA scale. So this scoring system uses three things to assess the level of consciousness of a patient: eye opening response, verbal response and motor response. In eye opening response, the maximum score given is 4. When the patient is opening the eyes spontaneously, that means without any stimuli, if the patient is opening the eyes, we are giving score 4. Then eye opening to sound, that means when we are calling the name of the patient only, the patient is opening the eye, we are giving score 3. And eye opening to painful stimuli, score 2 will be given. No response, score 1 will be given. Next, the verbal response of the patient will be assessed. The maximum score for this response, verbal response is 5. So if the patient is oriented to time, place and person, we can give score 5. Then score 4 will be given for confused talk. Patient is making full conversation, but patient is making the conversation in a confused manner. Score 4 will go for that one. Score 3 will be given for inappropriate words. Here the patient is not making a full sentence, but making some words which are inappropriate to the question. For example, if you are asking the name of the patient, patient may say blue. Then incomprehensible sound, the score 2 will be given for that one. Patient is making some sound which we cannot comprehend, like morning sound. Score 2 will go for that one, and when the patient is having no response, we are giving score 1. Next is the motor response. In motor response, the highest score will go. That means it is related to the movement of the patient. Highest score for this one is 6. It will be given when the patient obeys the commands. That means if you are telling the patient to raise the hand, patient is able to do that one, we can give score 6. Most localized pain, score 5 will be given. That means if you are making a painful stimuli to the patient, patient will bring their hands towards that side. We can give score 5. Then flex to withdraw from pain. So if you are making painful stimuli, patient is trying to withdraw from that one by using flexion. Score 4 will be given for that one. Score 3 will be given for abnormal flexion. Abnormal flexion is otherwise known as decorticate posturing. So in this condition, both the upper and lower extremities are rigid, but there is flexion of the upper extremity. Patient will be keeping their upper extremity flexed on the chest. Lower extremity will be in extended and rigid position. Score 3 will go for this one. Score 2 will be given for abnormal extension. That means both the upper and lower extremity are rigid and extended position. So this is otherwise known as decerebrate posture. And if there is no response, we are giving score 1. So total score for GLASGOW COMA scale is 15. So 15 score means the patient's level of consciousness is intact. Full level of consciousness is there. A score between 15 and 13 means below 15 but up to 13, patient will be having a mild disturbance in the level of consciousness. Score between 9 and 12 is showing moderate disturbances in the level of consciousness, and a score 8 and below, the patient is in coma. With another topic, we will meet again. Till then, bye.